Welcome back to our coronavirus updates. In this session, we're going to learn why superspreader events are so important for the spread of SARS-CoV-2 and why that is actually good news. The discussion around the spread of SARS-CoV-2 has concentrated on the average number of new infections caused by each patient, also known as R0, or the basic reproductive ratio. It's now well known that R0 for SARS-CoV-2 is somewhere between 2 and 3. So one COVID-19 patient on average infects 2 to 3 other people, and these infect 2 to 3 other people in turn. But that's just an average. In reality, however, some people infect many others, whereas most infect no one. Here are a couple of transmission clusters taken from a publication out of Hong Kong. There are two things that are striking here. First, there are some folks who infect a lot of other people. These guys here, this one, this one, this one, this guy, this one over here. And second, there are even more folks who infect no one else, who are at the end of the transmission chain. All of these people at the outer rim of the transmission cluster. Or these guys. Or these guys over here. This is what the individual reproductive numbers look like. On the x-axis, you can see the number of secondary cases, in other words, the number of people infected by one COVID-19 patient. And on the y-axis is the proportion of COVID-19 patients, and you can clearly see that between 70 and 80% of patients infect no one else. But there's a long tail of people who can infect up to hundreds of cases to the right. Several respected groups of researchers from Israel, the UK, and Hong Kong have shown that 80% of infections are due to somewhere between 10 and 20% of index cases. So the 10 to 20% of COVID-19 patients in this long tail here are responsible for 80% of secondary infections. Think of it as a fire that's burning and that's sending out sparks all around. The fire represents the initial epidemic in the Hubei province in China. The sparks are infected individuals who travel to other countries throughout the world. If most individuals never transmit the disease, as shown down here, then most of these sparks won't start a fire or epidemic in these countries. However, every so often, a person from the long tail, a so-called superspreader, will land in their country to start off a cluster of infections, and a fire will start burning. That could explain some puzzling aspects of this pandemic, including why the virus did not take off around the world equally after it took off in China, and why there were certain clusters like northern Italy, Spain, France, London, or New York. In this simulation by the London School of Hygiene and Tropical Medicine, we can calculate how many undetected COVID-19 cases need to be introduced into a population for an epidemic to take off. If we choose an R0 of 2.5, let's say, and we choose SARS-like transmission, we see that 4 cases need to be introduced into the population in order for the epidemic to take off with a 60% probability. If just 1 case is introduced, the probability for the epidemic taking off is just 20%. So, phrased differently, the likelihood of it not taking off is 80%. And this also explains why epidemics of SARS-CoV-2 don't necessarily take off even if there are already confirmed cases. Let's look at some examples. In May 2020, 16 Ohio jails reported cases of COVID-19, but only 3 had large outbreaks, where more than 10% of inmates were infected. In King County, Washington, a total of 105 long-term care facilities reported positive cases, but only 19 of them had 5 or more deaths, indicating potentially large outbreaks within these facilities. And among a total of 47 cruise ships reporting positive cases, only 7 had notable outbreaks. So basically, if the SARS-CoV-2 epidemic in China was that big fire that sent sparks flying around the world, most of those sparks simply fizzled out, which probably bought some places more time. Many public health experts think that this is an encouraging finding because it suggests that restricting gatherings where superspreading is likely to occur will have a major impact on transmission, and that other restrictions on outdoor activity, for example, might be eased. So where do these superspreader events occur? To answer that question, Leclerc and coworkers looked at what settings have been linked to SARS-CoV-2 transmission clusters. They searched the scientific literature for information about SARS-CoV-2 transmission clusters and extracted data into a publicly available Google Sheet that you can see here. You can see the setting where the clusters occurred, the country where it occurred, and how many cases were in these clusters. You can play around with that spreadsheet yourself. Here's a summary table of the most important cluster sites. What are the most important ones? There are bars, elderly care homes, hospitals, households, obviously, having a meal together, religious gatherings, schools not so much. Outbreaks in ships don't happen that often, but when they do, they can cause many cases to be infected. Shopping centers, sports facilities, work, and worker dormitories. And what do these all have in common? Well, 3 things, the 3 C's. Number 1, closed spaces, often with poor ventilation. Number 2, these places were crowded with many people. And number 3, it's places where conversations, shouting, or singing happens in close proximity. We've known for quite a while that SARS-CoV-2 is transmitted primarily indoors. This is a paper studying the spread of the novel coronavirus in China. These researchers identified 318 clusters of 3 or more cases between January 4th and February 11th. Only one of these 318 clusters originated outdoors. A study from Japan showed similar findings. These authors showed that the risk of infection indoors is almost 33 times higher than outdoors. And while conversations, singing, or shouting risk factors for superspreading events? That's what these authors looked at. Here are their findings. On the x-axis, you can see voice loudness or amplitude, and shown on the y-axis is the number of particles emitted. I guess you can clearly see that the louder someone speaks, the more particles are emitted. Another very interesting finding was that some people called the superemitters produced more particles than others. Shown on the x-axis is the number of particles emitted. On the y-axis is the number of participants. In this experiment, respiratory particle emission was measured while participants said "ah" for 5 seconds at roughly 85 decibels. Most people were in this area, with a mean particle emission of 5 per second. However, there were folks on the right here who emitted way more particles than the rest of the group, and these were called the superemitters. So they made exactly the same sound but produced more particles. These findings are extremely relevant for the following places. Crowded bars, for example, where people have to speak loudly in order to understand each other. Similarly, meatpacking plants are also noisy places where people have to speak loudly. And finally, many outbreaks have been reported during religious gatherings where people sang together. So singing also seems to be a risk factor. So what are the implications? Well, we need to cut the tail. Maybe not this one, but this tail here. We need to prevent these superspreader events as much as we can. As has been shown by these authors, if we manage to prevent any superspreader events of larger than 10 infected individuals, that alone could bring R naught down from 2 to 1. Think about it. Preventing these superspreader events could allow most of us to go back to normal. So here are the key takeaways. In order to prevent superspreader events, try to avoid a combination of the 3 C's outside of your own family. And that would be avoid closed spaces with poor ventilation, crowded with many people who have conversations or where vocalizations happen in close proximity, and that means within arm's reach of one another. If you happen to be in one of these situations nonetheless, then wearing a mask, keeping a distance, and hand hygiene are really important. That's it for now. If you want to improve your understanding of COVID-19, make sure to register for a free Medmastery trial account and check out our CME accredited courses. So stay safe and see you next time.